things are not good. Virus doesn't care whether you're old or adult. It's going to affect you. So I think that's what we're seeing right now. We took a sigh of breath, say middle of May, later before the memorial, because the number of cases had come down, people had followed directions, the admissions had come down, the ICUs had come down. However, since Memorial Day, there has been initially a linear increase. Now in the last 10 days, exponential increase. And that is really because people got complacent. The age group which is getting admitted to the hospital and even the ICUs is becoming a lot more younger.
People whose jobs are indispensable, who can't work at home, who have to go out into the world, are going to be most likely to be exposed to the virus and the most likely to be vulnerable to it. Rich folks have all kinds of ways to escape from the problems, to get out of the houses before they flood dramatically, to find alternative ways to go forward, whereas poor folks are, again, much more vulnerable, much less resilient, much more likely to be victimized by these kinds of events. And so this is a similar event to Harvey, and has a similar kind of differential impact on people.
Yeah, there's a lot more influx of patients, a lot more shortage of, overall capacity building. It's probably not as intense in all areas of Texas. So when you talk about that there's a lot of capacity available in Texas, yes, as a whole. But there are hotspots, and the hotspots is where there's a lot less ability to have more ICU beds or acute care beds. The city and the healthcare department is partnered with the Texas Medical Center, which is really the largest medical complex in the world. And what we're doing is we are sharing resources in the fact that the county hospitals have limited capacity and they got a lot more fills. So our hospitals and our sister hospital, we took care of some of their patients so we can help them. So we're working together to manage those patient loads, no matter where they're showing. We owe to the patient first, to the patient who are coming to our doorstep, but we're helping our neighbor also. It is really about public behavior. If people still have big gatherings in bars and on homes and go to the beach and have big parties and don't wear masks and don't do social distancing, lockdown can only have limited impact.